I think in pregnancy, it's normal to have concerns about anything we do, whether it's medication or vaccines or tests that we have done. Everyone worries about their baby, and that is normal. However, I encourage all women, whether they're pregnant or not, to get the COVID-19 vaccine. We know that women who are pregnant have increased risks compared to women who are not pregnant. Pregnant women have a significantly higher rate of needing to be hospitalized, needing to be in the ICU, needing mechanical ventilation or dying from COVID compared to their non-pregnant peers. And we know that the vaccines are safe and effective to decrease the risk of hospitalization and keep pregnant moms and their babies safe. Furthermore, if women are worried about their babies, we know that there's a significant risk of preterm delivery if women become sick with COVID-19. So women who are worried about the safety, I encourage them that it may seem that this research was rushed, it may seem that we don't have great safety data, but there's robust data collection ongoing, and we have a lot of great information about the vaccine in pregnancy. The V-Safe registry has more than 5,000 women, and they've shown no increased risks of miscarriage, of birth defects, of preterm deliveries, diabetes, hypertension, and so it's been very safe and effective for pregnant women and their babies. Like many other vaccines, mild side effects are common. If women get side effects after receiving the vaccine in pregnancy, things like fevers, chills, muscle aches, or a sore arm are not dangerous. They're frustrating and uncomfortable, but they're not dangerous to women or their babies, and they're usually very short-lived. So the Academy of Breastfeeding Medicine has come out with very strong statements that there is no need to stop breastfeeding or not start breastfeeding if you've been vaccinated against COVID. We have no physiologic reason why the vaccine would be dangerous in lactation, and we actually know that there's high rates of antibodies in breast milk, which should confer protection to babies who are too young to be vaccinated themselves. There is no scientific reason why the vaccine should be associated with infertility. We actually know that several women became pregnant while they were in the phase 3 trials of the vaccine, and there were over 50 women who had pregnancies after receiving the Pfizer vaccine and had no increased risks. We also know that there's been studies on semen parameters affecting fertility in men, and there's been no change for men either before or after receiving the vaccine. So the vaccine does not cause infertility. So we give lots of vaccines to pregnant women all the time, and we've been giving vaccines in general for decades. This is similar to those, and we have no evidence that any other vaccines cause infertility, and we have no reason to think that this vaccine would either. So far, no studies have shown any effects on fertility, so even with ongoing studies, we have confidence that it will not affect fertility for men or women either. I recommend that patients look at information from reliable sources, such as the American College of Obstetricians and Gynecologists, or the Society for Maternal Fetal Medicine, or the Center for Disease Control. These all include multiple cited references and are safe and accurate information. So it is normal to be worried about anything that we do, and everything that we do has risks and benefits. But I have strongly encouraged not only my patients, but also all of my friends and all of my family to become vaccinated to keep themselves safe. I, unfortunately, have taken care of many women who are critically ill from COVID-19, and if I had it my way, I would never again take care of a pregnant woman in the ICU or deliver a baby early because of COVID-19 or have to make these tough, gut-wrenching decisions because women are so sick. And I would beg anyone who was in my family or close to me to please get vaccinated to protect themselves. And if not themselves, to protect their babies if they're pregnant, to protect their family if they have children who are too young to be vaccinated. And we are all in this together, and it will take all of us to get out of it.